This month's Academy Mentoring Questions. I'm going to let you in on a little secret. When I introduce myself to allied medical professionals, sometimes I say this. Hi, I'm John. I'm a prosthetist orthotist. Some people think we only come out at night. Why do I say that? Because time and time again, I meet physical therapists, occupational therapists, nurses that have never seen one of us in the flesh. What, you say? Yes, because we don't bother to show up. Showing up matters. And when you talk about this month's question, how do you communicate and build relationships with other members of the multidisciplinary team? Well, you show up. You show up over and over. You go to them to see your patient with them during their treats. I know that might seem obvious to you if you're just a student. But I keep getting people that are really surprised to see one of us in the flesh. I know, having worked in offices where, the only time you ever got to get out of the office to see a patient was, like after hours. Or they'd let you go 10 or 15 minutes early so you could go there. Long after physical therapy has disappeared. So, you want to know my key secret to communicating and building relationships with the team? Show up. Get out there. I don't want to belabor the point, but yes, such a believer. Now, full stop. Yep, imagine you find yourself working in an office where their idea of being generous to you to let you see a patient with a therapist is, like I said, to, let you go 15 minutes early before the end of the day. Okay, so we might have to do something else. Well, we live in a time where these little devices are becoming exceptionally common as part of our regular practice. And almost everybody in the world now carries around something in their pocket that does a really good video. So, getting on the phone, communicating with your physical therapists, your occupational therapists, nursing staff, home healthcare workers, asking them to shoot a little video, taking a look at that video, deciding what next course of action is, if you need to do some intervention to make those changes and then get back with them when those are done, or if it's something as simple as you see something that needs to be done therapy-wise that's going to make a big difference, that gives you the opportunity to observe the video, explain it to that physical therapist, and get them to work on what will make the change for that patient. So if you don't have the opportunities to get out of the office to go see your patients with people in real life, get in the habit of always calling your therapists and encouraging them to take video of what they're seeing so that you can interact with them. Now, another thing that makes a really big difference when your patients come to you or you're visiting your patients without the other health team there, for you to shoot video of your patients and share that with the other care team providers so that the physical therapist, the physician, the nursing staff, where they had come from, all get an update on, hey, Mr. Jones now has his prosthesis and he's up and walking. Thought you'd like to know. All right. Next part of this is what disciplines are involved in this team in your everyday work. And they mention physicians, physical therapists, occupational therapists, insurance advocates. We call them patient advocates. Yes, you got to fight to get prosthetics paid for quite frequently. Researchers, etc. So I'm going to add to that home healthcare workers, nurses, other care providers in a home environment, director of nursing in a skilled nursing facility, or the unit secretary in a hospital on the hospital floor. All key people and a key part of the entire team. And depending on the way those different organizations operate, it may be your essential point person when it comes to building relationships, making sure you're working with the entire medical team. Finally, this month, how do you approach disagreements within the healthcare team? Honestly, we don't see it often. I'm going to say part of that is because we show up. Because we are collaboratively working, because we are sensitive to the goals that are important for patients and their therapy team, and we try to support those goals. But obviously it does happen when there may be disagreements. I'll give you the crazy one that I'm going to say we most often see. That's a physician that tells a patient, "You'll never walk again." How do we treat that one? Well, if the patient has the desire and we think the patient can achieve the goal of walking again, we move forward with the patient to achieve that goal. And we follow up with the physician's office with the video of them up and walking. Occasionally, you'll have an exceptionally well-trained physical therapist that may know the world of prosthetics and may have some other sense of what might need to be going on. If they do, take advantage of that. If they have a good knowledge about it, talk about it at that level. Explain what you're seeing, let them explain what they're seeing, and try to forge a way forward that makes sense. A little less likely, you may have a physiatrist that's exceptionally knowledgeable in the area of prosthetics. However, their knowledge might be very dated. I've had a physician that I'd put the patient in a total knee, and the physician explicitly asked for a Mauk knee. I didn't win that one. I put them in the Mauk. They didn't walk as well. But much of that came because that physician actually didn't know that a total knee was a hydraulic swing knee. That the total knee had advanced features for stance and for stance flexion. So going forward from there, we made the effort to educate the physician on some of the more modern knee options and why they frequently are a better choice for the patient. So I hope that helps. Show up, because you shouldn't be one of the people that physical therapists, occupational therapists, nurses, and physicians think only come out at night to do little things to devices and then disappear. Wish you well. Bye.